Hi, I'm Dr. Heather Hirsch, and welcome to my YouTube channel, Health by Heather Hirsch, where we cover all things midlife, menopause, and specifically hormone therapy. In this week's video, I want to talk about progesterone intolerance. This is something that I see in my clinic all the time. I have a private telemedicine practice. We're open in almost all states. I will link the description below. And it's something that really can frustrate women, or it can often lead to them just throwing in the towel about HRT, thinking that they cannot tolerate it. The good news is that there are alternatives to using prometrium or micronized natural progesterone, which is the progesterone that causes the most side effects, in my opinion. So if you or a friend or colleague has progesterone intolerance, this video is for you. Again, if you don't know me, I'm Dr. Heather Hirsch. I'm a board certified internist. I am the founder of the Midlife and Menopause Clinic at the Brigham and Women's Hospital. I am an author, a public speaker, and I launched my private telemedicine practice in 2023, and we'd love to see you. Also, if you're a healthcare provider and you love my videos, I have an incredible course, How to Prescribe and Manage HRT with Ease and Confidence. You're gonna wanna join. Everything is in the links in the description below. So let's start out with, what the heck is progesterone intolerance? Well, I will tell you that there's probably not much about this in a medical textbook, although menopause textbooks are not that long. But progesterone intolerance is something that I see clinically. What I really mean by this is that there are adverse side effects to the hormone progesterone, particularly the bioidentical progesterone, prometrium, or sometimes it's called micronized natural progesterone, or your bottle will just say progesterone. Now, progesterone intolerance has a wide range of severity, but before we talk about that, let me tell you what I tend to see when I prescribe prometrium to my patients. Now, backing on up, progesterone must be prescribed to a woman who is postmenopausal and using estrogen. Without a progesterone, this could increase your risk for uterine cancer while you're on your hormone therapy. So if you are on estrogen and you have a uterus, you will need to take some form of progesterone to protect the uterine lining. Progesterone or prometrium is typically the first-line progesterone that's prescribed by many clinicians. And this is because of its immense safety and its efficacy. And I tell my patients all the time that women fall into about one of three brackets or buckets when I prescribe prometrium. The first is that women feel so amazing with the prometrium. Now, the prometrium acts on the GABA receptors in our brain. It can make us a little sleepy or sedated, and it can help with nighttime insomnia or anxiety. In fact, if you love prometrium, drop a comment in the links below. About a third of women find that it really has null effect, meaning it doesn't give them any major benefits, such as sleep or anything else that would make them feel excited to take it. They just take it because I tell them you must take a progesterone with your estrogen, and they know that it is a part of their HRT regimen to ensure uterine safety. And then there's about a third of women who, on that bioidentical progesterone, have side effects. And these side effects range from mild to moderate to severe. So what would these side effects be? Well, it could be feeling too sleepy or overly sedated, or some of my patients will just say, I just feel blah on it. It can cause water retention or bloating. In fact, a lot of women feel that hormone therapy causes weight gain. And while that could be true, I'm going to also let you in on a little secret that progesterone can cause some water retention. And those numbers that you see going up on the scale might just be water retention from the prometrium. Some women will also notice really poor moods on prometrium. This can sometimes cause more anxiety or more depression. And of course, we don't want any of these things to happen. Now, this severity can be quite wide. So some women will say, yes, it causes some sedation or a little bit of bloating, but I can handle it, all the way up to some women tell me they look at prometrium and it really causes immense fear, panic, and side effects, and they want to throw in the towel and never take HRT because of these side effects. Okay, so if this is you, what are your options? Let's go. Some women will try using the prometrium intravaginally, which means, yep, taking that little capsule and putting it into the vagina. It's going to absorb through that mucous membrane, and sometimes this can help to ameliorate some of the side effects and symptoms. Now, it's still systemic. That's why it can be used this way. It's going to reach the uterus to help to protect the uterine lining. However, because it's still systemic, it's still systemic. So because it's still systemic, some women find that if they're in the mild spectrum of side effects, using it intravaginally can help avoid first pass metabolism. So it may avoid some of the sedating feelings or the bloating or the water retention. But I have found in my practice that if your side effects on prometrium were more of the moderate to severe, it's likely that you're still going to experience these if you use the progesterone intravaginally. Now, it's totally worth a try. You could absolutely go for it. But if this doesn't work, let's go to the next option. The next thing that you could try is changing the formulation of progesterone. Meaning, a lot of patients prefer bioidentical progesterone, the micronized natural prometrium, the one that I've been talking about in this entire video. But that is not the only progestin that is on the market. There are synthetic progestins that are just as safe. They are just as FDA approved as progesterone, and these can be used as well, and oftentimes can mitigate the side effects from prometrium. Prometrium is a really big molecule, so I actually find that it has more side effects than the other progestins, but on the same coin, it also tends to have more benefits if you fall into one of those benefit categories, so we often try it first. So, of the synthetic progestins, agestin or norethindrone is a really good option. This is something that would be prescribed by a clinician, and it is taken orally every day. And I almost always use my progesterones at bedtime because they can be sedating or they can cause sleepiness. Norethindrone, while we're on the topic, could also be prescribed in something called the Perimenopause patch, which is a combined estradiol and norethindrone patch that is twice a week. There is also levonorgestrel. Levonorgestrel is a progestin found in the weekly Perimenopause patch. So again, anytime you change a different progestin formulation, this could really ameliorate those side effects of the prometrium. Another synthetic progestin is Provera or medroxyprogesterone acetate. Now, this was the progestin used in the Women's Health Initiative, and so this progestin has just a little bit of controversy around it. Is absolutely fine if you are taking it, is FDA approved. It's just that most women nowadays prefer the bioidentical, again, which is the prometrium, or one of the other synthetics like norethindrone or levonorgestrel. Another option is Duve. In fact, I have a great full-length video on Duve here. What Duve is a combination of conjugated equine estrogens and beta-doxyphene. The beta-doxyphene is a SERM. It means that it blocks estrogen at the breast and uterine tissue. And because it blocks estrogen at the uterine tissue, or it's an antagonist at the uterus, you don't need to take a progestin or a separate progesterone with Duve. Now, this is a once daily oral medication, and I would talk to your doctor to see if this is right for you, but I have absolutely seen this, again, mitigate some of those side effects with progesterone intolerance because of the beta-doxyphene. It protects the uterus and you don't need to take another progesterone with it. And lastly, one of my favorite options for progesterone intolerance is a progesterone releasing IUD. Now, I have a whole video on IUDs here. I highly recommend you watch both the video on Duve and the IUDs if you're really having moderate to severe side effects on the prometrium, because I find these last two to be particularly effective. Now, an IUD is not everyone's first go-to option, but I will say in almost every single patient that I have placed an IUD in, because the progesterone released from the IUD is not systemic, it stays just within the uterus, this really mitigates the progesterone intolerance. The nice thing about having an IUD is also it will decrease your risk for uterine cancer. It's great insurance policy that you will have very little or no bleeding, and you can very easily titrate your estrogen dose without having to worry about your progesterone dose or without having to worry about any of that progesterone sensitivity that you may be experiencing. Now, you're definitely going to want to use an IUD that's releasing progesterone. So the brand names are Mirena, Kyleena, Liletta, Skyla, and the IUD that you don't want to use is going to be the Paragard because that does not release any progesterone. I hope this video was helpful to get you started in thinking that there are various different options besides for just micronized natural progesterone or prometrium, and the other options do tend to reduce the side effects of that prometrium intolerance. If you have prometrium intolerance, you are absolutely not doomed. I still believe there is a way for you to do hormone replacement therapy, and it's just a matter of trying to change up those different formulations or maybe a route, and sometimes even reducing the dose of the prometrium can help, so long as you're also reducing your estrogen dose as well. I hope you found this video really helpful. If you have progesterone intolerance, drop a comment below, because you've got a lot of sisters out there who also are struggling with it, but I am really here to say there is so much that can be done. If you are looking for a knowledgeable expert clinicians, I see patients in my private telemedicine clinic, and there are affiliates of the Health by Heather Hirsch MD Collaborative that are taking patients in almost every state. We have a wonderful clinic where we also have community and a whole 8-hour course by yours truly. We would love to see you, and appointments are readily available. Thank you guys so much for watching. As always, I hope that you gleaned something new out of this video. Let me know what else you want to learn about, and I'll see you guys next week in a brand new video. Bye everyone.